Good evening wherever you are. This is Etha Vale from ConferenceHype. Our segment will focus on first-line zolbetuximab plus MFO-LFOX6 and nivolumab in unresectable CLDN 18-2 positive gastric or gastroesophageal junction adenocarcinoma, a Phase 2 trial. From the 2026 June edition of Nature Medicine. There is an unmet need for effective and safe treatments for patients with metastatic gastric/gastroesophageal junction adenocarcinoma. Targeting Claudin 18 isoform 2 and programmed death ligand 1 represents a promising strategy. Zolbetuximab, a CLDN 18-2 targeting antibody, plus chemotherapy improved survival outcomes in patients with CLDN 18-2 positive, human epidermal growth factor receptor 2 negative MGGJ adenocarcinoma. Cohort 4 of the global, open-label, Phase 2 ILUSTRO study examined first-line zolbetuximab plus MFO-LFOX6 and nivolumab. Here we report results from cohorts 4A and 4B. The primary endpoint of ILUSTRO was specific to cohort 1 and was previously published. The main efficacy endpoint of interest for cohort 4 was progression-free survival, as assessed by the investigators per response evaluation criteria in solid tumors version 1.1. From the 2026 May edition of Nature Medicine, lung cancer screening with low-dose computed tomography has been proven to reduce lung cancer-specific and all-cause mortality. The UK launched the NHS England Targeted Lung Health Check program in 2019, which has now become the National Lung Cancer Screening Program, with full coverage expected by 2030. Here we present the progress and outcomes of the program. People aged 55-74 were offered low-dose computed tomography of the thorax if they had ever smoked, and if risk thresholds, as determined by multivariable models, were met. Delivery of the program is through regionally federated clinical infrastructure and leadership, with national strategic, clinical, and economic frameworks. The program has invited over 2 million people, with 7,193 lung cancers diagnosed 63.1% at tumor, node, metastasis stage 1, and 12.6% stage 2 to March 2025. This has increased the early-stage proportion of lung cancer in England over 5 years, particularly in socioeconomically deprived regions. From the 2026 May edition of Nature Medicine, prioritizing artificial intelligence-detected imaging findings may reduce the time to diagnosis of lung cancer. This prospective, multicenter, randomized controlled trial tested whether immediate AI prioritization of primary care-requested chest X-rays influenced time to computed tomography and lung cancer diagnosis, the primary outcomes. Secondary outcomes included the number of urgent suspected lung cancer referrals, incidence and stage of lung cancer, times to urgent referral and treatment, concordance between AI and radiology reports, and algorithm accuracy. AI was available in both study arms, with AI prioritization randomized by day. 97,731 participant CXRs, 4,405 were excluded due to data compliance issues or failure of randomization, resulting in 93,326 CXRs analyzed. A total of 13,347 CTs were identified, with 2,766 performed within 14 days of CXR. From the 2026 May edition of Nature Medicine, homologous recombination deficiency arising from BRCA1 or BRCA2 or PALB2 mutations confers sensitivity to platinum chemotherapy and PARP inhibition in pancreatic cancer, and may enable prolonged disease control with immune checkpoint blockade. The Phase 2 POLAR trial evaluated maintenance pembrolizumab plus olaparib following platinum-based chemotherapy in biomarker-stratified metastatic PC. 63 participants were enrolled into 3 cohorts, Cohort A, Cohort B, and Cohort C. Cohort A used a 2-stage design with co-primary endpoints of at least 43% response evaluation criteria in solid tumors objective response rate and at least 77% 6-month progression-free survival rate. This concludes ConferenceHype's coverage of the May 2026 issue of Nature Medicine. Did we miss an article, or which finding deserves a deeper follow-up? Tag us on X and join the conversation. If this review helped you keep up, please like the video and subscribe so you do not miss the next broadcast.
This is ConferenceHype. Stay with us, coverage continues.
From the 2026 May edition of Nature Medicine. Accurate prediction of risk of progression from smoldering multiple myeloma to active multiple myeloma is paramount to individualized early therapeutic strategies with minimum risk of overtreatment. Current risk stratification models do not account for evolving biomarker trajectories. We assembled a cohort of 2,344 patients with SMM from 7 international centers with longitudinal clinical and biological data to train and validate the precursor asymptomatic neoplasms by group effort analysis, SMM risk models. 4 evolving biomarkers were significantly associated with shorter time to progression, M protein increase greater or equal to 0. 2 GDL1, involved uninvolved serum free light chain ratio increase greater or equal to 20, creatinine increased 25% and hemoglobin decrease greater or equal to 1. 5 GDL1. PANG-SMM outperforms established models, including the 2220 and IMWG models, by more accurately predicting progression, even without biomarker history or recent bone marrow biopsy. From the 2026 May edition of Nature Medicine. Tuberculosis remains a major societal burden, yet data on long-term mortality following TB diagnosis and treatment are limited. We conducted a nationwide Brazilian cohort study using linked data to quantify long-term mortality following TB. We matched individuals diagnosed with TB or individuals who had completed TB treatment to TB-free individuals. Used competing risk methods to analyze natural causes and cause-specific mortality. In the diagnosed cohort, the risk of 14-year natural cause mortality was significantly higher equals 2.16, 95% confidence interval equals 1.96237. RRs were significantly elevated for deaths due to cancer, cardiovascular, endocrine, respiratory, and external causes. The treated cohort presented elevated natural cause mortality risk, with similarly increased RRs across specific causes. From the 2026 May edition of Nature Medicine. Burkitt's lymphoma is common in sub-Saharan Africa, yet diagnosis is often delayed due to limited pathology capacity. Here we evaluated blood-based liquid biopsies from 377 children and young adults with clinically suspected lymphoma at 4 hospitals in Tanzania and Uganda, assessing diagnostic accuracy and turnaround time. After extensive pathology capacity building, a gold standard diagnosis was established using tissue morphology, a limited validated immunohistochemistry panel, and independent dual histopathologist review. Using clinical features and circulating tumor DNA markers, MYC mutations, MYC immunoglobulin translocations, and Epstein-Barr virus fragmentomics, we trained 6 penalized logistic regression models with tenfold cross-validation. The best-performing model was externally validated in a prospective real-world cohort. Diagnostic accuracy, yield, and TAT were compared head-to-head between liquid biopsy and the gold standard in 58 participants. From the 2026 May edition of Nature Medicine. There is substantial interest in the use of glucagon-like peptide-1 receptor agonists in type 1 diabetes, but data on the long-term clinical outcomes are lacking. Using National Electronic Health Record data from 174,678 patients with type 1 diabetes, we conducted a sequential target trial emulation from January 2013 to March 2024. After propensity score weighting, GLP-1 raw initiation was associated with significantly lower risks of major adverse cardiovascular events. 5-year risk, 4.3% versus 5%. Risk difference minus 0.7%, minus 1.2% to minus 0.2%. Hazard ratio, 0.85, and end-stage kidney disease, HR 0.81. No increased risks of hospitalization for diabetic ketoacidosis or severe hypoglycemia were observed. These findings suggest that GLP-1 RAS may be beneficial against major adverse cardiorenal events in patients with type 1 diabetes without compromising safety. This concludes ConferenceHype's coverage of the May 2026 issue of Nature Medicine. Did we miss an article, or which finding deserves a deeper follow-up? Tag us on X and join the conversation. If this review helped you keep up, please like the video and subscribe so you do not miss the next broadcast.
This is ConferenceHype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 May edition of Nature Medicine, ChatGPT Health was launched in January 2026 as OpenAI's consumer health tool and has reached millions of users. Here we conducted a structured stress test of triage recommendations using 60 clinician-authored vignettes across 21 clinical domains under 16 factorial conditions, yielding 960 total responses. Performance followed an inverted U-shaped pattern, with the most dangerous failures concentrated at clinical extremes, non-urgent presentations, and emergency conditions. Among gold standard emergencies, the system under-triaged 52% of cases, directing patients with diabetic ketoacidosis or impending respiratory failure to 2448H evaluation rather than the emergency department, while correctly triaging classical emergencies such as stroke and anaphylaxis. When family or friends minimize symptoms, indicating anchoring bias, triage recommendations shifted significantly in edge cases, with the majority of shifts toward less urgent care. From the 2026 May edition of Nature Medicine, elevated blood levels of phosphorylated tau are diagnostic of Alzheimer's disease and are associated with the deposition of amyloid beta in the cerebral neuropil. Elevated p-tau levels have also been associated with cerebral deposition of Danish amyloid and prion protein amyloid. Here we analyzed p-tau in serum from 4 different cohorts of people with the most common types of systemic amyloidosis, transthyretin amyloidosis, and immunoglobulin light chain amyloidosis. We found higher levels of serum tau 181 in the AL and ATTR groups than in controls. Subsequent analyses revealed that these effects were more pronounced in the presence of polyneuropathy and in AL compared to ATTR amyloidosis. Individuals with different forms of PNP that were not due to amyloidosis did not exhibit elevated p-tau 181 levels. In cases of presymptomatic ATTR, p-tau 181 levels increased as a function of predicted years from symptom onset. From the 2026 May edition of Nature Medicine, clinician-patient conversations form the cornerstone of mental health care. Large language models could hold promise for this domain, but their effectiveness in patient-facing interactions remains largely unproven. Here we introduce a cognitive layer architecture that enhances general-purpose LLMs with specialized clinical psychotherapeutic reasoning capabilities. In a randomized, double-blind evaluation, 227 human participants generated naturalistic mental well-being session transcripts by interacting with different therapy agents. Consortium of 22 expert clinicians assessed these transcripts, finding that LLMs augmented with this architecture consistently outperformed both standalone state-of-the-art LLMs and human clinicians across key clinical competencies required for delivering high-quality cognitive behavioral therapy. We validated these results in an analysis of 19,674 transcripts from a large-scale, real-world deployment, where an LLM embedded within this cognitive layer architecture was used as part of healthcare delivery to support 8,920 users seeking mental well-being assistance. From the 2026 May edition of Nature Medicine, triggering receptor expressed on myeloid cells 2 regulates microglial function and is implicated in Alzheimer's disease pathogenesis. Here we conducted a phase 2 randomized, double-blind, placebo-controlled trial of a humanized TREM2 agonistic monoclonal antibody in 381 participants with early AD. Participants were randomized to receive AL002 or placebo intravenously every 4 weeks for 96 weeks. AL002 demonstrated sustained target engagement and pharmacodynamic responses in the central nervous system, as demonstrated by reductions in soluble TREM2 and increases in osteopontin in cerebrospinal fluid, respectively. This concludes ConferenceHype's coverage of the May 2026 issue of Nature Medicine. Did we miss an article or which finding deserves a deeper follow-up? Tag us on X and join the conversation. If this review helped you keep up, please like the video and subscribe so you do not miss the next broadcast. This is ConferenceHype. Stay with us, coverage continues. This concludes Conference Hype's coverage of the May 2026 issue of Nature Medicine. Did we miss an article, or which finding deserves a deeper follow-up? Tag us on X and join the conversation. If this review helped you keep up, please like the video and subscribe so you do not miss the next broadcast.
This is Conference Hype. Stay with us, coverage continues.